Lewis? Yep.
And hello everyone, welcome to the webinar for the University of Glasgow's online distance learning MSc in Critical Care. We're hosted by Anno from the university team, and my name is Mark Beeston. I'm a clinical doctor who works with NHS Greater Glasgow and Clyde in critical care, and I'm also part of the faculty for the MSc in Critical Care programme. And I'll let everyone else introduce themselves. Paul?
Hi, my name's Paul Whitehead. I work in the Digital Education Unit in the College of Medical Veterinary and Life Sciences. And my main role in this course is helping to create and curate all the online learning materials that are so important to all our distance learning students.
Hi, my name is Melania. I have a role similar to Mark. I'm a medical doctor working in NHS Glasgow in GDC, Greater Glasgow and Clyde, mainly in the Queen Elizabeth in Critical Care Department. And I'm also part of the faculty for the Masters in Critical Care.
Hi, I'm Barry Morn. I'm the Programme Administrator looking after the online distance learning programme for critical care. Any aspect to do with the administration comes via myself. I will be your first point of contact for every aspect to do with your student journey. So do come to me if you have any issues.
So now we're just going to run through a very short presentation that just sort of outlines the course program. So I'm just going to share my screen. Lovely. And so the University of Glasgow obviously has a long and proud tradition of research and is currently ranked first in Russell Group for teaching. And there's obviously multiple Nobel laureates who've been associated with the university. In terms of the university as a whole, there's 43,000 students from more than 140 countries, and it's ranked in the UK's top 20 for graduate employability. And there's also multiple student clubs and societies that both on-campus and online students can take part in. So in terms of the Masters in Critical Care at the University of Glasgow, this is a programme that is delivered fully online through a virtual learning environment. There are 2 exit points. That is the postgraduate certificate, a postgraduate diploma, or students can go on if they achieve the credits to complete a dissertation and achieve a Masters in Critical Care. As I said, the learning is done exclusively via state-of-the-art learning environment with emphasis on research and governance principles that underline contemporary clinical care practice in critical care. There's a combination of clinical courses and non-clinical courses that also cover areas such as leadership, governance, and management skills. I don't know if you want to describe the structure of the programme, Barry?
Yeah, certainly. So students can enroll initially. They can apply for the MSc, which is the 180 credits, or they can do a PG Cert, which is 60 credits, and that could be a combination of 20 credit courses or 10 credit courses. And once students have done their 60 credits and been through the University Examination Board, where their grades will be ratified, they can, should they wish, enroll onto the postgraduate diploma or onto the MSc. Altogether, in order to do the MSc, the programme will consist of 10 core courses and a dissertation, and the dissertation is worth 60 credits.
Melania, do you want to discuss sort of the course structure?
Yeah, so basically, there are a number of courses that you can take. Basically, in the first year, you need to take research and scientific writing skills, which counts for 10 credits. This will soon change to 20 credits. And there are a number of, as Mark was saying, clinical courses. The different courses basically are allocated differently each year. That means that in this year, this academic year, 2025-2026, there will be some clinical courses that will be different from the ones of next year, as you can see. So this year we will have trauma and multi-organ failure, sepsis and respiratory failure. And in year 2, the courses will change. That allows for a new cohort to start basically. So different students can start at different points. And in year 3 is when students decide to go for a master's degree, they can complete a dissertation or an independent research. The research project counts for 60 credits, and you have 12 months to complete this. Basically, you can choose your topic, and you will have an allocated supervisor, where you can basically discuss your interests and which is possible for you to achieve in this period. And you can set the parameters and basically work with your supervisor a plan in order for you to achieve the research project. Typically, there are some topics or some modalities that will be easier, but that will depend a lot on the student and basically their availability. But this all can be discussed with our supervisors.
Sorry, no worries. So the specific aims of the program are to enable students to study in depth a wide range of clinical and non-clinical topics relative to the field of critical care. We want students to be able to apply advanced knowledge and skills to their own clinical practice in their own local units, and to develop their ability to critically appraise, publish research, apply analytical techniques, and present scientific arguments and opinions eloquently. We also want students to develop their academic abilities to enable them to create guidelines that integrate evidence and literature with practice considerations from their local units. And this is shown through our assignments, where often we'll ask you to reflect on your practice in your local units and integrate that into your answers. We also want students to develop clinical leadership skills in making complex clinical management decisions appropriate to their role within their local units, and to develop the skills in delivering presentations and communications with their peers and with the faculty. So the program has a combination of formative and summative assessments. These will often take the format of a recording. So, for example, a presentation or a podcast, a so-called oral assignment, and then a written assignment. And each course will have formative and summative assignments, where students can get feedback on their formative assignments before progressing to the summative assignment. And here's an example of a written assignment here for a neurocritical care assignment. Melania, do you want to discuss about teaching approaches?
Yeah, so basically, you will have in the duration of a course, you will have different lectures, which will account for presentations made by lecturers that are typically consultants or people that are basically experts in their field. And you will have lectures, you will have webinars, which are mainly done by the course leads. There are typically 2 webinars per course. So basically you can join. They are not mandatory, but basically you can join. You can ask any questions. And because the course is so asynchronous, basically these are the only activities in which you can join together at the same time. There will be some discussion forums, and some of the courses will have formatives, for example, in which you need to discuss different cases that the students need to present in the forums. And you have to do some reflective practice in some of the courses as well. So thank you for listening. This is basically a short presentation, but we are really happy to answer any questions that you might have. You can find more of the materials regarding the courses in the webpage. And yeah, happy for you to join.
So I don't know, Barry, if you wanted to mention about the points of entry into the MSc as well.
Yeah, so students entering, So a student who enters on a PG cert or a PG diploma, they will have 4 years to undertake their studies on that particular part of the program. So in order to get the PG cert, students have to do 60 credits. In order to do the PG diploma, they have to do a total of 120 credits, and they have to be completed within 4 years. For students who go on to do the MSc, that has to be completed in a total of 6 years. So 180 credits is 6 years. The other PG cert and PG diploma is 4 years. And the flexibility of this course, we get students all the time will perhaps study for 2 or 3 years. We're aware that with online distance learning students, that sometimes the work-life balance, things get in the way, and students do wish to step off a program. That is completely fine, and for them to take a break from their studies and to come back, as long as the full credits of the program, whether you're on the PG cert, PG diploma, or the MSc, is completed within the relative time span, then it is fine for students to take a break in their studies.
Yeah, thanks, Barry. And I think one of the strengths of this program is through using asynchronous online distance learning. It allows our students, who are often busy healthcare professionals from around the world, to participate in this MSc program and commit to their learning in their own time and in a way that is flexible and suits them. So although all the courses, there are deadlines for assignments, etc., people can engage with the online learning when best suits them and can break it up into chunks that's most suitable. And
in terms of the hours, let's say a potential student needs to dedicate every week, how would, assuming somebody is working with the NHS, how many hours do you suggest dedicating in order to pursue, let's say, an MSc?
so through a combination of the lessons themselves online and then the independent study that's required, I think the lessons themselves should take, it varies week to week, but I'd say there's between sort of 2 to 4 hours of content each week, Paul, indicatively. Would that be about right?
Yeah, that sounds about right. And of course, it depends on the pace at which you go through it. The beauty of the online materials is they're completely flexible. You can stop and start them whenever you want. You don't have to sit through a whole hour of a lesson. You can just do 10 minutes here, 10 minutes there, whatever suits you. But yeah, it would typically be between 2 and 4 hours a week, I would say.
Yeah, and then the amount of independent study required to continue your learning alongside the program is the amount of independent study required. We probably expect a similar amount of time again in order to maintain your progress.
I think one query most students would have is, given the fact that they're already working, would this course allow them to connect with other professionals? Like, do you offer any kind of networking platform, like in-person events or conferences, where they can interact with the students with whom they're undergoing the course, or other professionals?
So basically, the events that are synchronous is, as I was mentioning, the webinars, which typically are twice per course, or at least in the courses that are 10 credits, which are basically 5 weeks. So that is basically a webinar roughly in week 2 and 4. And this is when students basically can gather. Typically, the webinars are organized by the course lead. But other than that, basically, we typically can recommend things basically for students, but because typically the cohorts are made with students from different parts in the world, there are no live events, so basically not face-to-face events.
I would add to that, though, that there are opportunities for students to connect with each other. There are, as part of the courses, there are interactive forums where students share their experiences and their ideas. And quite often we do see in those discussions that students from different parts of the world will share different approaches and form kind of connections with each other that way and share that kind of knowledge. So it is a rich learning opportunity that this platform allows.
And for somebody who's not fully yet committed to, let's say, clinical care program, can you elaborate on the taste of courses that are on offer?
So there's a range of clinical and non-clinical courses. So they're all available on the program website. The clinical courses cover areas such as respiratory failure, sepsis, neurocritical care, and there's also plans in the works to hopefully introduce new modules in the future on medications and critical care, and I believe cardiac critical care as well as the planned one for the future, but they're not live currently. In terms of the non-clinical, they focus around leadership, governance, and management in critical care in order to give students a foundation in that would allow them to go back to their own departments and develop as leaders there. It's also highly sought after by employers. And if students do wish to pursue it, there is an alternative sort of leadership stream of the critical care MSc they can take, where they focus solely, well, they have more of a focus, sorry, on the non-clinical courses, on the leadership and management courses.
I would also say as well that though students are studying independently on this and they're studying online, that they're never alone. As Paul has referred to, we do have a discussion forum, and any question that a student puts into that, there will be a response from an academic member of staff within at least 48 hours, if not sooner. So there's always feedback to any questions that you may have. So people sort of believe that online distance learning is sometimes working in silo or by yourself, but there is always support available, if not by contacting the academic staff, but also a member of the teaching team or through myself.
And any more questions, Anil, or are you happy for us to draw this to a close?
Maybe I think one query would be about the electives and the dissertation process, how that works, and how students go about the whole, what subjects students generally.
Yes. So the dissertation part of the MSc program is typically an independent piece of research or evidence synthesis that's carried out by students. Early on in that process, you'll be allocated a supervisor where you can have correspondence with them to discuss ideas and discuss how best to progress things. And they will often keep you right in terms of selecting topics that are going to be most appropriate to pursue going forward in terms of things that are going to be achievable and attainable within the timescale of the MSc program.
Okay. Thank you so much. And does the program offer a pathway to a research degree like a PhD? How do a lot of students who undertake the MSc ODM tend to move on to a PhD? Would you say that's something a lot of students do?
So we have seen it varies because basically students come from different backgrounds, and many students basically want to do the MSc to apply what they know in their clinical setting. But certainly the PhD, following the MSc with a PhD is a possible route, and basically this master's has a strong focus on the academic side and on research. So really positions you quite well in order to follow a PhD route. But it's not what everyone does, let's say, but you will be in a really good position to do so.
Thank you so much.
Well, thank you so much for your time, everyone. If anyone has any questions, feel free to get in touch with us via this email address here, and we'll do our best to answer any questions that you have. And please do explore the webpage as well, where a lot of the frequently asked questions, the answers can be found.
Thank you very much, everyone.
Okay.
Thank you.
Thank you. Thank you.